everyone, my name is Jessica Gale and I'm a grad student here at Eastern Illinois University, and this is my systematic review oral abstract, and my topic is the effects of sleep deprivation on caloric intake in adults. A brief overview of this presentation. I will first go into the background of sleep deprivation and caloric intake and obesity, and then I will move on to my objectives, methods, results, and conclusions. So starting with background, I'm going to go over sleep deprivation and caloric or energy intake, and then I'm going to tie that into obesity. So with sleep deprivation, that is getting less than the needed amount of sleep, which for adults ranges from 7 to 9 hours of sleep per night. The effects of sleep deprivation include excessive daytime sleepiness, moodiness, and hunger. Many Americans may feel the effects of sleep deprivation through their work, especially shift workers such as first responders or factory workers. So caloric or energy intake is different for each person based on their current weight, height, and activity level. Food choices can affect weight. And so this ties into obesity because most of us have always heard that it's diet and exercise, and I wanted to look at a different factor that could go into that. So obesity is when a person's weight is higher than what is considered normal weight adjusted for height. More than 1 in 3 adults were considered to have obesity, and obesity can raise risk for other chronic diseases such as hypertension, cardiovascular disease, and diabetes. And the rates of obesity in America are still rising. So the objective of this paper is to see if there's a relationship between caloric intake or energy intake and sleep deprivation. Kind of as I mentioned in the last slide, just wanting to see if this is another factor that can help people with maybe lowering their risk of obesity, or if they are obese, helping them with losing weight. So for the methods of my systematic review, I used 4 electronic databases. I used SynHal, PubMed, PsycInfo, and the nursing. So some of the keywords that I did was for food, energy intake, caloric intake, or food intake. And for sleep, I did sleep deprivation, sleep disturbance, reduced sleep, sleep loss, and sleep quality. A total of 229 articles were found between all of the databases, and 10 were included in my systematic review. Some of the inclusion criteria that I had was within the past 10 years, so from 2010 to 2020, adults age 18 or older, human subjects, and full text. I then put that all in my Prisma chart to evaluate the results of the studies. So an overall theme between the 10 articles was increased caloric or energy intake, and there was a breakdown of macronutrients. So they saw an increase in fat intake and an increase in carbohydrate intake. Those were the results after reviewing all 10 of the papers. Moving on to the conclusion. So first, for the examination of results. The evidence supports that sleep deprivation has an effect on energy intake, which then can lead to higher caloric intake overall, which can lead to gaining weight and then could lead to obesity. So sleep deprivation could be a critical factor in helping with obesity, especially with their diet factors. And now to the implications. Further research is needed to specify the amount of macronutrients consumed. There was talk on that, but some studies did say that it was high carbohydrate or it was high fat, and some said both. So there needs to be more consensus on that. And more research needs to be done for the overall health and how sleep deprivation plays into that, looking at the diet, especially this could really help people with obesity. Here are my references, and if you have any questions before my presentation, please reach out to me. Thank you.